Hello, everyone. Welcome to today's webinar, How Health Plans Can Prepare for the New Normal. My name is Laura Beth Ezel, and I will be your host for today's webinar. I am just so pleased that you could join us. Now, today we will explore the impact COVID-19 has on near-term and long-term investments healthcare plans need to consider as we transition to the new normal. Now, to help us set the stage and understand these capabilities, I am pleased to introduce today's speakers. Jeb Dunkelberger is the head of growth at Notable Health, a digital medical assistant company that services payers, providers, and patients at the point of care. Jeb currently leads all strategy, sales, and marketing for Notable Health. Jeff Trinkner is the strategy insights and planning manager at ZS, a professional services firm with more than 35 years of experience delivering value for healthcare clients. In his role, Jeff works with health plans to solve a range of business problems, including go-to-market strategy and sales execution issues. Well, it is a pleasure to have you gentlemen on today's webinar. I would like to hand it over to Jeff to provide an overview of the objectives for today's discussion.
Great. Thank you, Laura Beth. So as we all know, COVID-19 has impacted each of us, both personally and professionally. Today, we're really going to focus on how that impact has manifested itself in the sales organizations of health plans, along with some of their primary constituents, namely employers and brokers. So with our session today, we have three main objectives. First is really to better understand how those impacts differ between health plans and employers. So what are some of the factors that drive these impacts? And what did the impact mean for health plans? Next is really to understand how sales organizations can employ a framework to define the stages of the COVID crisis and the steps they can take during each stage to transition from a sense of keeping afloat to really establishing a lasting competitive advantage. And lastly, we'll discuss changes in investments required for sales organizations so that they can shift their operating model to effectively and efficiently adapt to COVID and prepare themselves for future market disruptions. So coming out of today's discussion, our aim is for sales leaders to really understand the current environment, but also recognize that they have a silver lining as well. And it presents them an opportunity to really shift from that short-term crisis adaptation to thinking about longer-term success in a post-COVID world. All right, and one of the most immediate measurable impacts of COVID is the significant drop in medical utilization. Many members, health plan members, out of either an abundance of caution, have been afraid to really access healthcare resources. Earlier in the crisis, many have been asked to not utilize resources to free them up to treat COVID, to treat those affected by COVID. The avoidance of care is really manifesting itself in really alarming ways. For instance, weekly cancer diagnoses were down by 46% at one point, even though we know that cancer isn't waiting for COVID to clear up. But the results are clear. Health plans have really seen a decrease of approximately $36 billion in medical expenses paid out quarter over quarter compared to the recent trends. And this drop is really unprecedented too. We know that one of the Affordable Care Act's key ambitions was to bend the cost curve down or reduce the amount that healthcare spend has been growing in recent years, but not necessarily to reduce the actual cost of healthcare. And so we've seen that COVID has done something that the ACA did not, which is a 17% drop quarter over quarter based on the current trends. But that impact has been inconsistent across health plans and employers. So for health plans, we've seen many report record net incomes in quarter two, and that hasn't gone unnoticed in the public eye, the press or with government leaders. We've seen recent press articles such as the New York Times calling out that major U.S. health insurers report big profits benefiting from the pandemic, which has definitely not helped the impression of or the perception of health plans in the general public. But when we look at employers, they're in a very different position. They're continuing to struggle to make payroll and keep the lights on. As of June, as of the end of July, approximately 130,000 businesses remain closed, with more than half of those expected to remain closed permanently. When it comes to healthcare, self-insured employers are definitely see that immediate drop in medical expenses, but realize that it's short term, and expect a large spike on the horizon. Whereas those who are in fully insured products foresee a significant increase in their rates. A recent survey of Fortune 500 companies found that more than 8 out of 10 companies believe that future cost increases would be due to increases in premiums from their health insurers. Jeb, anything to add there?
Thanks, Jeff. I think you did a wonderful job summating a lot of the ongoing changes that we're seeing in the market. One of the things that I'd like to call out, as I know we'll be digging into this deeper today, is really around the changes that are outside the control of most of our sales reps. And so one of the things I want to underscore is a focus on really a focus on controlling what you can control. And what I mean by that is, allowing your sales reps to do things in the market that are going to be seen as non-traditional, as now is a time more than ever to get creative. And so as some of you may know, different insurance companies have processed different rebates due to the underutilization that we're seeing. But I think there's still going to be a need for management of expectations. So we're going to have to move away from the simple education of brokers and employers and really think about some new things that are going to be needed for our sales teams. And so one of the things I also want to highlight is that we're going to have to focus on soft skills. I know we'll dig into that today, but while we focus on soft skills, we also need to focus on leveling up our analytics as well as our automated sales processes. I really think that now more than ever, partnerships will be made or killed during this time. So I'm excited to dig in with you, Jeff.
Great. Thanks, Jeff. And speaking of those impacts and challenges for health plans, we also know that impact, even with employers, is not consistent either. We've all seen the headlines, understanding that industries such as food services have been hit significantly harder than some others. They've lost more than 25% of their employees over the last 6 months. As we see on the chart in front of us, even though food services have been significantly impacted, they traditionally don't offer benefits to their employees. Only about 1 in 5 actually do. However, every industry has seen some impact, as we can see, and some loss of employment over the last 6 months. Those industries least impacted by COVID-19, utilities, finance, and professional services, are generally smaller than pre-COVID. However, they only account for about 17% of all employees with employee-sponsored health care. So even though they're the least impacted, they traditionally don't make up a large pool of group insurance customers there. And when we shift our focus to healthcare, unsurprisingly, healthcare accounts for about 16% of all covered employees. But even healthcare has not been immune to COVID and has lost approximately 5% of all those employed in healthcare compared to pre-COVID. And Jeb, do you want to elaborate there on the relationship between health insurers and healthcare organizations?
Well, I think that this is one of those unique situations where you have to ask yourself, what's the phenotype of your commercial clients? And as you begin to think about some of those larger clients, I wouldn't be surprised if some of them are healthcare providers in and of themselves. Right? Knowing that hospitals are some of the largest employers within our local communities, I think it's going to be very important for organizations to look at these commercial employers as also healthcare organizations that have undergone a dramatic shift in their financial stability. Right? And so understanding that at one point during this COVID pandemic, hospitals were losing between $1.2 and $1.7 billion a day. this has a dramatic impact on both those hospitals as well as the organizations that support them. So as you begin to think about the impact of COVID, also begin to think about the impact to those employers, with some of them not being as obvious as others. Thanks, Jeff.
Thank you, Jeb. And this also brings up another kind of undercurrent that's been present over the last 10 years or so, and that's the role of health plans within the healthcare delivery system. So quite a bit of the analysis have really portrayed health plans as not adding sufficient value to the healthcare delivery system, at least not compared to their cost structures and recent profits. And so this really highlights an industry trend over the past 10 years. So we've seen that health plans have lost about a quarter of their members in the traditional risk-bearing roles of fully insured group insurance. Over the same period, administrative service only enrollment has increased by 15%. So it's really highlighting how the role of health plans has changed over the last decade. As an aside, their role with government-sponsored plans such as Managed Medicaid and Medicare Advantage, membership has more than doubled in that same time period. And as we've seen, COVID has really drawn the U.S. healthcare delivery system back into the public narrative, probably more so than any time since the ACA debates. And with it, highlighting the perceived weaknesses and inefficiencies, including the role of health plans. And as we know, if COVID wasn't enough by itself, we have a number of other current happenings that are combining with COVID to really create an overwhelming sense of uncertainty right now. We know that the Supreme Court will soon rule on the constitutionality of the ACA. We have a presidential election upcoming here at the beginning of November, and the campaigns leading up to it. A lot of that is focusing on COVID specifically and healthcare in general. And so this turmoil is generally casting health plans in a negative light. We do have a few notable exceptions, such as some of the Blues offering a second round of premium rebates, Anthem and UHC offering either financial support or additional rebates, but that hasn't really been enough to really change the narrative here. We do feel that this does have the COVID crisis does have a silver lining, though, that the uncertainty on so many fronts really provides an opportunity for health plans to reshape the narrative and recast their role within the healthcare delivery system. And like many previous periods of uncertainty, crises can either serve as a barrier to progress or a catalyst for change. At the same time, since COVID has really taken a hold since the end of March, we've seen that overall sales activity for health plans has decreased due to either businesses closing or businesses looking for stability with their current carriers. Based on our recent data, though, we see that we're expecting a bigger uptick in that activity, so this lull is probably very temporary. With that all said, COVID is really bringing a once-in-a-career opportunity for us to rethink our sales models and how we go to market beyond just continuing to adapt the current way we're executing. Jeb, you want to talk a little bit about that opportunity and openness to change?
Yeah, no, absolutely. Thanks, Jeff. And I think that as you look at the previous slide and this slide, there's a lot to take from it, right? And so first and foremost, I think that COVID-19 still represents many of the old issues that we've dealt with in healthcare. I think a lot of people have heard that saying that COVID-19 did not break the system, but rather it showed us where the system was already broken. So you still hear those stories around surprise billing for things like COVID tests, as well as things like high-cost claim management for things like COVID patients, right? And for me, at least, this still feels a lot like when I used to get these phone calls around end-stage renal disease patients, right, that were high-cost, relatively unmanaged, and there was little that the insurer could do due to the market share and other forces that were to be. But as you said, Jeff, there is a silver lining here. And what we're seeing is that silver lining is really twofold. One, every single stakeholder is expecting change, right? Internal as well as external stakeholders. And so I know we'll dig into that, but I want to underscore this. It's important because when an entire audience is expecting a change, it creates a political window that I think you can leverage. And two, as Jeff already talked about, we see this movement over the last decade of employers moving from fully insured products to more level-funded or ASO-type products. And I think this is going to create a unique opportunity for the fully insured products to regain some of the membership that they've lost over the last 10 years. I'm very excited to see the poll responses that we'll get from today. But then also, I really am excited to look at how over the next 6 months we see organizations and brokers begin to think through their mitigation and risk tactics around these types of unforeseen utilization patterns. Right? So as we begin to think about COVID moving into the next 6 to 12 months, I think it's a fair assumption to believe that we'll see some of our self-funded clients begin to move back into fully insured products simply because of the risk mitigation and ability to cover their financial risk at a broad and as well as a local level.
Great. Thanks, Jeb. And so let's talk a little bit more about how we can actually reimagine our sales models given our current situation. So as Jeb mentioned, the current conditions really create an unprecedented opportunity to reshape how sales organizations go to market in response to COVID. The impact of COVID has changed over the last 60 days, and we expect they'll likely to continue to evolve over the months to come, hopefully not years, but definitely over the next months to come. As we discussed earlier, those impacts to health plans and their sales organizations will likely have some unique elements or unique dimensions across different health plans and lead to different challenges and circumstances there. To really drive a change to the sales model in the current and our dynamic and rapidly changing environment, we can employ a framework that allows us to break it down into different phases. So our first priority is really a near-term adaptation to the current business environment or the current marketplace to maintain our business continuity, kind of tread water, so to speak. During this phase, we really want to focus on executing the current business model in new ways with an emphasis on speed rather than pausing and having an extensive planning phase. So after we're able to establish a semblance of stability within our sales organization, we can really shift our focus to remaking the sales approach during business unusual. And in this phase, we want to define how we want to operate going forward in a proactive manner to tackle COVID and other potential crises down the road. So during this phase, key areas of change are who we target and how we cover them, utilizing a more agile and iterative approach. And once we have that solid base for our sales model, we can leverage its ability to be dynamic to really remake the overall sales organization and its supporting functions to allow us to quickly pivot and adjust as we need. So this capability is really the core of what will help sales organizations be ready for the new normal, no matter really what that turns out to be. It'll definitely require some additional investments in the near term to prepare for that long-term success. Jeb, anything to add here?
Yeah, Jeff, I think overall, everyone understands the three phases here quite well. And I think depending upon where you are located in the United States, you're probably somewhere between phase 1 and phase 2, hopefully working your way to phase 3. But the take-home point here is that every single stakeholder is expecting change. And I mean that for both internal as well as external. So as we begin to dig in today, on these different phases of adaptation, I'm going to make sure that I highlight some of the internal as well as some of the external things that we can be doing. And again, I want to briefly undertone the fact that premium pricing, network configuration, and even things like consumer experience, we're just assuming those as table stakes, right? They're somewhat out of the control of the sales rep. And so what we're going to focus on are things that you can control both internally and externally. Thanks, Jeff.
All right. And as we think about crisis adaptation, the first phase, we really want to make sure we can execute the current sales model in those different ways and ensure our business continuity. We can start with some no regrets moves, understanding, as Jeb, as you said, that many sales organizations have already started down this path. I'm sure many of you have already completed this, but want to make sure we're still highlighting it here. First is upgrade virtual capabilities. So it goes without saying that these virtual capabilities are fundamental to improving the customer experience right now, as well as the experience of your teams. So some items that fall under this category are environmental upgrades, such as lighting and camera and microphones and so forth, but also being more purposeful with our scheduling and cancellation handling. For instance, we can invite experts or colleagues to our video meetings to really create a more compelling event and discourage cancellations. We can also make sure that we're deploying a more coordinated digital outreach. So this is a great opportunity to develop and deploy a coordinated sales and marketing digital outreach strategy, such as customer-centric marketing. And another fundamental area is making sure that we're resetting the expectations. I think we all intrinsically know that face-to-face is a more effective way to communicate with our customers than the phone and even video. However, we do know from experience here at the S that face-to-face or virtual can be more effective than face-to-face in some situations, especially when you have multi-participant meetings. So it's really about identifying those situations and make sure that we're setting them up for success, no matter how we're communicating with our customers. The other big part here on crisis adaptation is making sure that we're starting planning now for entry into the new normal. And I want to emphasize that this is not a re-entry, because the marketplace is not going to look the same when we emerge from COVID-19 versus pre-COVID-19. And simply recycling our old sales model is not going to hit the mark there. And entry planning really is a very, I would say, intensive process, making sure that we're including things like timeline, location, local restrictions and precautions, everything to immunity cards and vaccination status, not to mention the comfort of and preferences of our customers and our sales teams. During COVID, our expectations have definitely changed. We've had exposure to a lot of different industries. For instance, just like a lot of people on the call here, I spent quite a bit more time in front of the TV than I normally would. And I noticed that, my TV, if I hit the guide button, I can very quickly see what's included in my plan. If I want to add something else, it's very clearly laid out, including the cost. And while I'm watching TV, I can't help but notice all of the car insurance commercials that promise premium rebates of 15 to 20% because we're not driving as much. So likewise, I think it's fair to assume that our plan members are also going to have different expectations coming out of COVID. They're going to expect to have easier to use digital interfaces that really clearly show what is covered, who's in network, including the costs if we go outside of those networks. And similarly, sponsors are going to expect to pay less in premiums when their employees use significantly lower levels of medical resources than expected. And Jeb, this is definitely not the first time that we've seen industry shifts during economic disruptions.
No, I think you're right. And I want to kind of hit this one in a few different ways. So, first and foremost, it's very important to remember that great companies have been born during massive economic recessions. So thinking about companies like Disney, Microsoft, General Electric, and even HP, they're all born during different periods and recessions. So externally facing, your employers need to know that you are a business partner, right? You're one of the largest line items in terms of their cost, and they need to know that you're in this for the long haul with them, right? So when you talk about soft skills, when you talk about partnership, now is the time to reinstate that. Right. In terms of internally, when you're focusing on your sales team, this is also a unique opportunity to leverage this recession in somewhat of a different way, where you can look towards morale boost and capturing new market share. If you can position your team to see this as an opportunity to maybe reinvent their brand, right? I was talking to one sales leader from a large commercial insurer, a top 20 commercial insurer, and they said this is a great opportunity to restore and rejuvenate some of the sour relationships that they have in the market, be it with certain brokers, be it with certain employers. Now's the time where people's guards are down and they're willing to accept help, probably more than ever. So in terms of the next steps, non-regret moves are plentiful, right? So regardless of the general election, the path of COVID, if we're going to do another shutdown, those are things you can't control or predict. But you have to know that there are non-regret moves that, despite the direction of one of those junction points, there are some great bets to be made. And the worst move that you can make right now is not making one. So place your bets, and we're going to dig a little bit deeper into that now, but really excited to see how you all take this and really galvanize your teams into the future. Thanks, Jeff.
Great. Thanks, Jeb. And moving into that, into the business unusual. So when we're able to move beyond just reacting to the immediate crisis and really struggling to keep our heads above water, we can now kind of shift our focus to, while still maintaining our business as usual to our customers, turn our attention internally to proactively restructuring the sales model. So this allows us to get out of that reactive mode, start shifting to looking at how ideally we would like our sales model to function in the future. We understand it's can be a very significant undertaking, though it is a little bit easier to break down when we think about it in terms of reprioritize, redeploy, and refine. And so during this phase, what we really want to accomplish is making sure that we have a higher rate of connection with our customers, that with those connections we have a higher impact per connection, we have less wasted effort, and that our teams feel a greater sense of satisfaction through those interactions as well. And so when we look at the first element, reprioritize, is really rethinking who we target. So COVID and other market disruptions have definitely changed our priorities, where some of those areas of opportunity lie, and our objectives with employers and brokers. In pre-COVID, in our experience of working with health plans, we've rarely, if ever, encountered a sales organization that had a segmentation that considered how customers actually wanted to interact, and especially how effective a virtual interaction would be with that customer. So with COVID, that's something that this level of insight with our customers is really critical. And then when we think about redeploy, is really adjusting the way that we in turn cover those targets. So during this phase, we really want to reassess how we cover the different segments and use the optimal way to cover them. Understanding that we do have new constraints in terms of how we interact with our customers. Virtual is still predominant, and it still has a very heavy reliance on our reprioritized targeting that we talked about earlier. And finally, talking about refinement is kind of perfecting on the fly. So any change like this, even if we had a perfectly static environment, would require some type of feedback loop to understand what is working, what is not working. So we have inputs in terms for the next iteration, for the next level of changes. When an environment is changing rapidly at the same time as it is now with COVID, it really emphasizes the importance of of being ready for an iterative and dynamic approach to targeting and coverage to account for that. And Jeb, anything to add here?
Well, Jeff, I'm going to steal out of a page out of our book from a recent engagement with a customer that you and I were both working with, which is really focused on the segmenting and targeting that now requires a lens on how COVID has impacted each employer category differently. Right? Some employers have actually not gone through that much of an alteration in terms of business as usual, while others have dramatically transformed their business models. So understanding those different employer phenotypes and being able to place them into categories is going to allow you to strategize on how to approach and engage each one. The same topic of COVID is going to be discussed in a varied amount of ways, which is going to require your sales team to be quite dynamic. And then finally, to your point, Jeff, I think we all have seen the circles of the CRM train, right? And in terms of garbage in, garbage out. Now is the time for objective dashboards where you need that codified feedback loop that's going to give you those market insights. So if there ever was a time to perfect that CRM tool, it seems like now is the time for it. Thanks, Jeff.
Yeah, great point, Jeff. Thank you. All right, and then talking about once we have our sales model established, we are going to likely need some new capabilities for our sales team. And in our experience of working with a lot of sales organizations, whether it be to help them evaluate their sales talent or establish and maintain learning and development programs, we do see that most sales orgs will need some incremental level of investment here to build these new capabilities to make sure that they're able to drive efficiency, effectiveness, and adaptability within their sales teams. So these examples here are definitely not exhaustive, but are some of the key capabilities that we wanted to highlight today. So, the technology part, we touched on this earlier, is making sure that we are enabling our sales teams. This also includes things like AI-enabled or AI-guided selling tools. Jeb, you touched earlier on the insights into customer changes. So this is more critical than ever, is to understand what our customers are going through and bring that back to our sales teams. When it comes to driving a more effective sales team, we want to make sure we have sufficient support services for our customers, making sure that they can easily interact with us. Telehealth is a great example here, something that was used in the past, but not nearly as significantly as now. Also, the ability to connect with our teams through things like enhanced portals and chatbots. The things that we commonly see in other industries can be employed here to help sales teams. And lastly, when it comes to adaptability, these are critical here, is the soft skills. So creative problem solving, EQ-based selling techniques. So those are really important. But also future trends. So our sales teams need to really understand how the current trends and undercurrents in the healthcare delivery system will really impact them and their customers going forward. So, one thing I wanted to leave everybody with is, key takeaways that we need to start thinking about these capabilities now. And it takes some time to move these capabilities from introduction to the sales team all the way through to becoming a regular part of the way they do business, including coaching and feedback cycles. So another very critical support element here to a more agile sales model is understanding that sales organizations don't work in silos. So allowing them to focus on customers, putting their primary focus on customers really requires a lot of supporting functions across the organization to make sure we're freeing up the sales team's mind share to really, put that spotlight there. And so of those supporting functions, sales operations is definitely one of the most critical. And we know that an agile sales organization will require an equally agile sales operations function. So in our experience, we've seen many health plans employ very highly manual sales processes, use low fidelity data sources that require a ton of manual integration, and none of these things are going to scale, much less really satisfy the data and analytics needs for the sales team going forward. And so going forward, one thing we see is that sales operations teams can really offload the processing of a lot of these tasks based on how frequently they're executed. So if it's something that requires a high level of brain power, so to speak, advanced analytics is really a great solution here to take the burden off the sales operations team. It's also a great time to introduce AI and ML capabilities if they're not already present in the sales operations organization. So for those tasks that are frequent but don't require that same level of brain power, robotic process automation is a great capability to really handle these frequent tasks and offload them and unburden the sales operations team. And of course, we still have a role for human brain power here, but we want to reserve those cycles for the less frequent tasks that still do require substantial brain power. And this will definitely help the sales ops team scale going forward. So one of the other critical elements here is a consistent, unified set of data sources to support the sales operations team and the sales teams through their push to become more agile organizations. So a great example of this is utilizing MDM to automate data refreshes, automate that integration, automate quality checks, and really present a single unified user interface for these teams. Did you have anything to add here, especially how this relate or what you've seen different sales teams?
Yeah, Jeff. I love this graphic, and the reason why is because I think that it communicates much of the realities of today, despite what many of our personal opinions might be. Which is, number one, there's a tremendous amount of unrealized value that can be yielded from technology. If there is ever a time to deploy technology, it is now, right? I was talking to a sales leader just last week, and he had talked about how, just like road work is easier when you do it at night, right now, given a lot of the disturbances and pauses and unique times that are now available for the sales organizations to come together, it is the right time to deploy some of this technology, right? That being said, we think we also all know that things cannot live and be sourced out of your reps' heads. Everything needs to be brought in, right? So as you talked about high fidelity data, Jeff, I think that's an excellent point, that we have to continue to pull that information out of our different sales reps' heads and begin to centralize it. And when you think about RPA, robotic process automation, I know for a number of organizations, this seems like a foreign concept, a futuristic concept. I can tell you right now that R does not stand for rep, P doesn't stand for person, and A certainly doesn't stand for account manager, right? Robotic process automation is being used today. Even though I'm a Silicon Valley-based company and tend to be leaning towards thinking that I'm more futuristic than I am, I can tell you that I have been across the country and seeing RPA used in different ways. And really the key reason for this is because it's to reduce cognitive burn and to preserve energy for these more complex and empathetic interactions. So getting the low menial task work out of the way and allowing your sales leaders and representatives to think more creatively, more dynamically, and most importantly, to allow them the time and energy to be in that consultative sale that is needed now more than ever. Thanks, Jeff.
Great. Thanks, Jeff. All right, now we've talked about dynamic targeting, dynamic coverage models, and our capability to constantly refine those. When you think about it a little bit in a broader perspective, and how that impacts the sales force design overall. And it definitely starts with a continuous customer prioritization process. So the continuous assessment, valuation, and effort analysis really provides the insights that are needed on the current and future market conditions that will help us identify when and how to pivot the sales force going forward. And so those insights will really drive a Salesforce design that has a structure that can adjust and scale with changes in demand and customer prioritization. We want to ensure our sizing and effort allocations ensure optimal coverage and making sure that we're emphasizing, for instance, efficiency when we are resource constrained. We want to ensure we have an approach to territory design that allows seamless changes in account assignment, levels of travel, for instance, or even competitive development. And lastly, we talked a little bit about capabilities, but an overall talent strategy that identifies capabilities such as versatility and thriving on change, and making sure that that's incorporated in our hiring and our coaching plans. So going into a little bit more detail, bringing all of those elements together definitely requires some additional supporting elements. You know, we spoke earlier about the importance of flexibility and ability to scale and the role of process automation and advanced analytics. So I really want to highlight two other areas here on this slide. The first is incentive plans. So incentive plans are going to be top of mind for many, if not all, within the sales team. You know, traditionally, these plans are basically set and forget. Once a year, we'll update the plans, possibly update the plans, set the quota, maybe perform some adjustments to the quota mid-year to reflect a significant change. But for the most part, done once a year and then move on. Well, that approach it's very difficult to align with a more agile territory and coverage approaches as targets or assigned accounts are changed, as geography has changed. Definitely doesn't line up to the original quotas that were set at the beginning of the year. And I definitely don't have to remind people of the impact a misaligned sales incentive plan can create on the sales team. Everything from loss of motivation, incenting the wrong behaviors, over or underpaying for performance, and back to that concept of mind share you spoke about earlier, Jeb. These things can become top of mind, and so issues with incentive plans can really distract from the focus on our customers. And so we need to ensure that the sales incentive plans are similarly rethought to operate in an agile environment. And the second is the customer engagement process. So this process is really our window to our customers, something that will take on even more significance given the current constraints and the rapidly changing market environment. And so ultimately, our goal is an adaptive execution model that allows our local teams to be hyper adaptive and really enabled to pivot very quickly in reaction to those local market conditions. And Jeb, I know we also previously talked about shared services models.
Yeah, no, I think this is an area that few organizations are talking about, but I want to make sure we call out today, which is I think that we're going to see an evolution of the shared services model or the SWAT team approach within healthcare. And the reason why is, in years past, we've seen this type of model used for things like clinical topics where we have medical directors that have been brought in to be subject matter experts on a given topic. But now there are new topics, right? Digital engagement, digital front door, virtualization of networks, new care management programs. All these things need to be explained at a pretty in-depth level. So if your training's not where it needs to be, you can use this SWAT team or shared services approach in a really new, novel way. And I think that when it comes down to engaging your customers, you can do this in a more bespoke manner while bringing more resources to bear through this telephonic approach. So I know we'll dig into it a little bit, but just as an aside, one of the things I do want to call out is a medical director that I was talking to who represents a large oncology care management program. And he's been able to triple the amount of support meetings that he's been attending from years past simply due to the fact that he can do it now from a tele perspective. And so now that he is able to engage telephonically and through these virtual meetings, he's not stuck in the car driving around. And so that allows him to bring more value to the client or the prospect while at the same time leveraging this kind of shared services approach. Thanks, Jeff.
Great. Thanks, Jeff. I really want to come back to this customer engagement process. The current environment, the record profits for health plans, continued struggles for businesses and their employees mean that the customer engagement process plays an even larger part than pre-COVID days as far as the success of sales teams. I want to touch briefly on this a concept of tailored value delivery, or basically hyper-customization to specific customer segments with the ability to pivot quickly. And so when we say tailored value delivery, we mean redesigning our messaging, offerings, and value proposition to really highlight the needs that have emerged recently in our new reality. It also means identifying new ways to support our customers in that changing new world. So as we discussed earlier, that could mean customizing messaging at both industry and local market levels. And so, Jeb, before we move on, anything you want to add there on the value proposition?
Well, the value proposition is quite interesting, right? Because I think that modalities of communication are driving expectations, right? So as you use computers to engage with different people, they begin to then ascribe similar expectations from that of Amazon or Netflix or other things that they are using that same computer for. And so that consumer engagement is kind of presupposed by their expectations driven from these different modalities of communication. So as you begin to think about the value proposition, I think it's really important to call out that healthcare has been extremely politicized. So as we think about different ways to engage in tailoring our value delivery and going after, that mindset selection, right, and that contact cadence, as you're beginning to think holistically about how you engage those different employers, you've got to think about how can you change the message for each and every one of them? How can you change your engagement modality for each and every one of them? Giving them that tailored feel, while at the same time having a structured and standardized approach from the background that you as a sales leader are really trailblazing at the top. Thanks, Jeff.
All right, thanks, Jeb. And so returning back to our investments in this sales team, rep success in the new normal is definitely going to require a set of core competencies to make sure that we can be effective, efficient, flexible. And these capabilities will definitely pay dividends no matter what the new normal looks like. And so below we have highlighted some of those capabilities that we think are going to be the most important, but by no means, again, is this an exhaustive list. And so also want to emphasize that these capabilities will need to be embedded in our coaching and competency models and make sure that they become part of our business as usual as sales teams. In our experience, we've definitely seen that the driven by insight capabilities, or really being able to utilize data and analytics, and the two capabilities that we've highlighted under in the adaptive section here, can be the most challenging for sales teams to introduce and to make sure that they're incorporated in the way that sales teams go about their daily business. And so looking ahead, in closing, we do foresee that sales organizations, as we mentioned earlier, do have a short window to really act before activity starts to return back to normal, if not eclipsing it, which will definitely put more pressure on the sales organization and just adding another challenge to actually carry out a transformation. We also see employers, as Jeb mentioned, employers gravitating back towards more risk-bearing products to protect themselves from the uncertainty, but also allowing them to really refocus back on the core competencies of their business as well. And lastly is in our projections, we don't see the commercial group enrollment returning to pre-COVID levels until late 2021. And of course, this is going to add even more pressure within the marketplace as health plans seek to grow books of business. There'll be more competition for those members. Jeb, anything to add there?
Yeah, I think that during this conversation, we put on a number of different things. And as I said from the very beginning, I wanted to break apart the internal as well as the external needs as you're going through this evolutionary phase. And really the three things that I want to leave you with that are applicable to both internal and external are this. One, empathy and soft skills are going to drive partnerships. And that empathy and soft skills, not just for your clients, but it's also your staff. Right? So as we all know, the dog barking in the background, the baby crying, we have to become more amenable to those types of things, be it a client or a staff member. Two, technology and automation. It's table stakes. It's table stakes for your clients' expectations, especially now that they're engaging more via the video and computer than ever before, as well as for your staff. And then finally, unfortunately or fortunately, there's going to be no setting it and forgetting it when it comes to your sales strategy. These are things that are going to evolve on a daily, if not weekly cadence. And so for all of us, we need to be prepared and aware that we're going to continue to see an evolution month to month here as we're moving forward, both from our clients as well as our own internal sales strategies. Thanks, Jeff.
Great. Thanks, Jeb. And with that, I hand it back to Laura Beth.
Well, Jeb and Jeff, thank you for truly an enlightening conversation and actionable strategies that healthcare plans can implement now and in the future as the industry just continues to adapt to this new normal that we find ourselves in. I truly enjoyed that presentation. Your stats and your graphs were just incredible, so thank you. Throughout the presentation, we did receive several questions from the audience, so please continue to submit any questions via the Q&A widget at this time if you want to get that question in. But we have a few minutes left, so I wanted to jump in and try to get to a few of these before we end today. First question here, should we just hire more telesales people and make do with fewer people in the field? What if virtual sales aren't effective or customers start demanding face-to-face? Great question.
Oh, I'll take that one. This is Jeb. So this is a great question. So in the short term, if you're seeing this as an effective path that are yielding desirable sales results, great, right? Thumbs up to you. And this is certainly something that you're going to be able to leverage in the future. One of the things that I've encouraged different sales leaders to also do is quickly poll their sales teams, right? Understand which sales representatives are willing to go out in the field, are willing to do face-to-face type meetings. As we all know, there's a pretty wide gamut in terms of opinions around and comfortability around meeting with other people. So naturally, you should poll your sales team to understand who's willing to go out, because that's going to tie into the next piece, which is, not allowing this to become some sort of gateway drug to complacency. I have some sales folks on my team that, would prefer now to do a phone call rather than hop in a car and drive 2 hours. I get it. I feel the same way, but we got to get up. We got to get out there, right? So don't allow this to be that gateway drug to complacency. Use the people who've identified themselves that are willing to go out in the field. And where I'd focus on is really three things. One, ensure your team has everything needed for telesales, the tools, the training, a good webcam, even Wi-Fi connection. I can tell you right now that even if technology is to blame for a bad meeting, it doesn't matter to an employer or a broker. It's just a bad meeting. Two, make sure that you identify new ways to leverage these types of meetings. So bringing in subject matter experts, like I talked about before, from the medical director from their oncology use case, is a great way to bring more value to each one of those interactions. And then finally, I'm still old school and think that the customer is always right. So as you said in your question, if they want to meet face-to-face, do your best to do that, right? Use that poll from before, identifying those people who are willing to go out in the field and meet the customer where they are, right? Even if it's just having coffee in a parking lot 6 feet apart, you're still meeting them where they are, and you're showing them the creativity that's needed to blaze into this new phase. Great question. Thanks for that.
Well, thank you for jumping on that one there, Jeb. Next question here. In my experience across organizations, Changes like this take a lot of time. Have other sales organizations adapted this model? If so, how do they implement it quickly?
Yeah, I'll grab that one. This is Jeff. Another very good question, and the short answer is yes. We have seen other sales organizations adopt agile approaches like we just discussed. Of course, previously, before March of this year, we didn't have the urgency of COVID to really adopt something like this. We weren't in the face of a global pandemic. However, it does show that even outside of COVID, that an agile approach like this is really a long-term way to address future market disruptions, and a lot of these are unforeseeable. So what we found throughout different implementations with sales organizations, several kind of keys to the transformation. One is making sure that we're also addressing the supporting organizations. As we talked about earlier, without bringing along sales operations, making sure we have a solid data foundation, that our comp plans are aligned, it becomes very challenging to develop and roll out an agile sales model like this. One of the other keys is ensuring that we have organizational buy-in. So typically transformations like this require basically a sustained change management process, making sure that we're openly communicating with the different stakeholders within the sales organization and the organization as a whole, and make sure that we are understanding the impact on everybody. And once we've gotten to the point where we have a really stable base for our sales model, that's when we can start executing in a more, I would say, rapid and iterative manner. And that becomes part of our operating model going forward. So at that point, it is much easier and quicker to roll out changes as we go forward.
Perfect. Thank you so much, Jeff, for jumping on that question. The great questions from our audience there. And that's all the time we do have today for questions. We would like to thank everyone for joining us today. If we were not able to answer your question, please know that we do capture all submitted comments, and someone from the team will follow up in the coming days. So thank you so much, Jeb and Jeff, for your presentations today. As a reminder, the recording of today's webinar will be available via the same link you accessed for today's live presentation. And we also encourage you to check out the resource list to access additional links that you may find useful. Thanks again to our presenters and, of course, to you, our audience, for joining us.